All right, so first let's talk about why we need Cox flexion, distraction, decompression. One is when your bones in your spine get misaligned, it puts extra pressure on these discs. So the longer that you have pressure on those discs, what can happen is these discs that are padding your bones in your spine, they begin to bulge out or herniate out. So over time, the further that they bulge or herniate out because of the misalignment or the dysfunction in your spine, it'll begin to press that nerve. So that is what you may have heard of as a bulging disc or a herniated disc, and you may have been told that you need surgery, but maybe not. So that's what Cox flexion distraction decompression is all about. So what happens when you have a surgery where they fuse your spine is they go in and they put screws into your spine and rods that attach to the screws so that this segment will no longer move like it's supposed to. Once they do that though, what's going to happen is the segments above it and the segments below it begin to have to work harder, and then now you're going to start having problems in those segments as well. We're actually, when it's called decompression, it's because there's compression on that disc that's causing it to bulge out or herniate out and put pressure on the nerve. So we're trying to decompress that segment so the disc will pull back into the disc space. So this technique is called flexion, distraction, decompression. And what we do, we use a specialized table that's been developed by Dr. James Cox to help manipulate or do the decompression on the disc and on the nerves that are in the spine. So this is something that's been studied and developed over 50 years. It's really the only technique, or one of the only techniques that's been federally funded. What it does is, instead of having to put a lot of manipulation or rotation into the spine, it actually goes in there and does flexion and distraction and helps to create a negative pressure inside that disc space to pull the disc back in and take pressure off the nerve. All right, so let's take for example that you have an L5 herniated or bulging disc. So that's about right here. So what we would do is contact the spine above where the disc is herniated or bulged, and then we would just begin a very slow process of flexing and distracting the spine, opening up that disc space, trying to take pressure off of the disc and off of the nerve. But what it's doing in there is actually decompressing that disc, so it's creating a negative pressure inside the spine so it will help pull that disc back in. And then you would come up and rest, and then we would do a little bit of massage effleurage in here, trying to get those muscles to relax a little bit and to release so that the adjustment will hold longer. Always asking the patient if they're feeling any pain or what's the discomfort level, because you don't want to create a lot of pain while doing this. This is very, very mild technique, because usually when the patient has a bulging disc or a herniated disc, they're in a lot of pain. The reason this technique is a lot different than what everybody thinks about chiropractic is because you don't hear a lot of popping and cracking. There's not a lot of rotation in the spine or manipulation. So that's the big misconception, is that everybody that goes to a chiropractor gets manipulated or can hear the pop that we hear a lot of people talk about. And that's why a lot of people are scared, because they are in so much pain they think that's the only thing a chiropractor can do. Well, here we're specifically trained. Yes, we can do the manipulations on the spine if that's necessary, but what we're trained to do here at South Georgia Spine and Joint Center is to not only manipulate, but when they have herniated or bulging discs, we can do this decompression therapy. This is a fantastic technique, and it's one that only we are doing here at South Georgia Spine and Joint Center.